Now, if we talk about different treatment options available for the hyperparathyroidism, there are four main treatment modalities. The first one is the surgery. Then we have some medications that are used for hyperparathyroidism, dietary supplements, and monitoring. For the surgery, the removal of overactive parathyroid gland, parathyroidectomy, that's very important. And then standard neck exploration. This is especially when there is carcinoma or adenomas. Exploration is very important to remove any surrounding lymph nodes to avoid the spread of the cancer. So surgery is important. Then the medications are for secondary hyperparathyroidism, and these are known as calcimimetics used for secondary hyperparathyroidism. Dietary supplements, calcium and vitamin D, and now we know that vitamin D is why important. It enhances the absorption of calcium from the intestine. So deficiency of vitamin D can also lead to deficiency of calcium. So both supplements can be used. And monitoring physical examination, calcium level, and kidney function should be monitored regularly, and if there is any abnormality that need to be managed properly. So all these are different treatment modalities for hyperparathyroidism. And hyperparathyroidism we discussed in detail now, that we covered all the aspects of primary, secondary, tertiary hyperparathyroidism. What are the causes of these types of hyperparathyroidism? What are the pathogenesis of these three types of hyperparathyroidism? How we diagnose, how we treat and manage these types of hyperparathyroidism.